Fiji's ground zero, the Colonial War Memorial Hospital, has seen an increase in the number of deaths since its inception in 1923. The Ministry of Health had strategically planned to safeguard the country's main hospital from the second wave of COVID outbreak in April. But today, the emergency department at the CWM Hospital is one of the hotspots for COVID-19. And given the rise in the number of daily COVID cases and deaths, it is evident the situation is going to get worse before it gets better. Over the past few weeks, Emergency Department registered nurse 𝐒𝐡𝐢𝐧𝐞 has had to deal with 9 deaths while working his shift. He expects this number to increase over the next few weeks. Some of the deceased were dead on arrival and some died while admitted at the hospital. Mr. 𝐒𝐡𝐢𝐧𝐞 is concerned that anti-vaxxers place the vulnerable at risk of succumbing to the deadly Delta variant. As Fiji grapples with the rising COVID-19 pandemic, the Colonial War Memorial Hospital's emergency department has seen a surge in the number of deaths and COVID cases over the past few weeks. This is projected to increase. I'm Giva Nataro, and this is Fiji Sound's Shine a Light program. For the months of June and July alone, not only has there been a spike in COVID cases, but also an increase in the number of COVID deaths. The Johns Hopkins University released data placing Fiji at the top of the chart as the country recording the most number of daily cases as of 18th July. On Wednesday this week, Permanent Secretary for Health and Medical Services Dr. James Fong announced the country recorded 21 deaths, the highest so far for the period of 14th July to 21st July. The majority of the deceased were the vulnerable population from the Lami, Suva and Nosori areas. They were either unvaccinated or had only received 1 dose of the AstraZeneca vaccine. As the crisis escalates, the CWM hospital has had to switch to a mitigation phase, a strategic move to protect the country's already overwhelmed health resources. When Shine a Light visited the emergency department, 4 makeshift tents were erected outside. They were put up about 3 weeks ago. This was part of the ministry's contingency plan to cater for the influx in the number of patients. Inside these tents were COVID-positive patients. They were the vulnerable group of our society. Some are also burdened with pre-existing medical conditions. There was not a single young person on any of the beds. The majority of these elderly patients were on oxygen and medication. No family members were allowed inside the tent. They'd have to be in PPE to enter the tents. All interactions were done with healthcare workers at the entrance of the ED, where relatives are updated on the condition of the patient. These patients were later transferred to the COVID wards inside the hospital. Before being admitted, a patient would have to be swabbed. Once the result is released, these patients are sorted into COVID and non-COVID patients. The 4 tents cater to 21 patients. There's an additional 20 beds inside the emergency department for COVID-positive patients. It's a similar sight inside the ED. Patients on oxygen and monitors, some stable and some seriously ill. Half of the west wing of the old hospital is catering for COVID patients. Bed spaces have also been provided in the acute medical, acute surgical wards, the 2 COVID intensive care units and the critical care unit. Oxygen supply is not a problem with enough stock available for patients treated in ED. Oxygen is supplied by BOC Fiji Limited in Lamy. Empty oxygen bottles are replaced twice a day. These oxygen bottles are also utilized by non-COVID patients. The ministry has also pre-ordered oxygen in light of the growing crisis. Patients who receive treatment at the Emergency Department Field Hospital are those who suffer from severe respiratory distress and need oxygen, patients with comorbidities who deteriorate and test positive for COVID-19, and those who are sick and require COVID-19 test. Despite the spike in new cases, strict COVID safety protocols and processes are maintained within the ED. COVID patients are taken through the emergency department before they are transferred to the COVID wards or the COVID intensive care units for seriously ill patients. The transfer of patients is conducted in an infection prevention control manner, ensuring there is no contact with other patients or medical staff. The number of patients requiring treatment varies, averaging between 40 and 80 patients per day at the emergency department. For non-COVID patients with underlying medical conditions, they would average between 30 and 40 per day. And in a particular shift, there are 8 nurses, 5 doctors, and 2 consultants who attend to COVID and non-COVID patients.
So emergency department is different because you need a large number to be available to respond to cardiac arrest, to respond to resuscitation, to respond to mass traumas, mass disaster situations. Yeah. So that's why we actually have those pool of people.
Emergency Department frontliner Ms. 𝐒𝐢𝐻𝐿𝐻 has been given extra responsibility during this crisis. There are now 2 teams at the department, a team stationed inside and another outside in the tents. Ms. 𝐒𝐻𝐿𝐻 is in charge of the outside tents.
For this, we have been given a little bit extra responsibilities because they have divided the emergency department into 2 sections. So at the moment, I am the nurse that's in charge of the tents outside. So with this current crisis, I've been given extra responsibilities. So I have to double check that my patients have oxygen, double check that all the meds are given, vitals are taken. And make sure that all my patients are comfortable in the tent and they enjoy their stay.
For Ms. 𝐒𝐻𝐿𝐻, his greatest challenges are nursing COVID-positive patients. It's worse when he has to deal with deceased positive patients.
Yeah, it hurts me a lot because I think of my family and how will they cope with it during this hard time. So I feel a lot of compassion for the family. And it's hard, you can't have a big funeral, a lot of people cannot attend it.
He last saw his son, girlfriend and parents in Vanulevu in February this year. He misses them and he longs for the day to finally meet them.
Especially when people post negative comments on social media about misinformation. It gives people a lot of different reactions. Some they react negatively to it, some follow it. And those people that follow negative criticism on social media are the ones that I would say that are slowing down the vaccination process that the Ministry of Health is trying to do at the moment. So we could achieve our 100% vaccination for people of Fiji. Yeah, we are challenged mentally as well. So yeah, sometimes I feel down. Sometimes I feel like quitting my job. But that's why we have family. They encourage you. I keep encouraging your family, your friends. That's how I manage to pull through. Yeah.
But for now, Mr. 𝐒𝐻𝐿𝐻 says it's an honor for him to serve the people of Fiji, and to see his patients recover happily is the best part of his career. Head of the Emergency Department, Dr. 𝐒𝐡𝐢𝐧𝐞 says they expect to receive a surge in the number of cases over the coming weeks.
Looking at the situation now, it's progressing. They expect it to be at level 1, level 2, whatever level it's going to be at, and you're preparing for that level. You projecting future, preparing. That's what contingency planning is. So as it escalates, you escalate your response. But you need to be prepared. So you prepare and then activate your response. This is why with the AUSMAT team, our medical staffs are working 24 hours around the clock.
He says so far their resources and projections have been in response to the escalating situation. This includes the training by the AUSMAT team for health workers, the work of FEMAT and MOH in creating capacity, and rapid vaccination. Dr. 𝐒𝐻𝐿𝐻 says their priority is to prevent the positive patients from getting more sick and ensuring that non-COVID patients do not contract the virus. In line with the growing crisis, government had also allocated an increased budget of $403.3 million for the health sector in the 2021-2022 national budget. The budget included the hiring of 238 intern nurses, 140 medical interns, 114 doctors, 10 nurse practitioners, 43 midwives, and $25 million COVID-19 contingency fund. Dr. Dan Holmes is the team leader for the AUSMAT Bravo team. He said he was aware of the situation in Fiji, but it wasn't until he set foot in the country that he saw what the real situation was.
It's very clear that the nurses and doctors and all the other staff, the various healthcare facilities are working incredibly hard. It's tiring. Of course, we've seen in other countries that this pandemic has affected healthcare workers disproportionately, and in many places people have become sick. So, and Fiji is no different. So there have unfortunately been a lot of healthcare staff who have been affected. Either they've been close contacts or they've had COVID themselves, and of course that puts extra stress on the system.
Dr. Holmes believes as the situation increasingly becomes serious, it will strain the country.
Sadly, the situation is becoming increasingly serious, and when we look at those the increasing numbers of deaths and serious illness, it looks like things are going to get worse before they get better, which will strain on the health system and will cause it to be a very difficult time for Fiji. What we can do is create as much capacity as we can and create the ability to look after people as best we can. Of course, we hope that will be enough and that we will be able to manage that. But I think it's safe to say that as we've seen the numbers of people with the disease go up, inevitably the number of people with severe disease follows that. And I do not think that we've reached the peak of that yet by any means. And I think over the next few weeks will be a challenging time for the health system. But the work that's being done by Fijian staff, Fijian medical staff, and the work that's being done by ourselves and others is designed to be able for the system to be able to manage with that influx as best it can.
Dr. Holmes says the hospital and the other healthcare facilities in the country were managing the crisis admirably.
The hospital and the other healthcare facilities are actually managing admirably, but we've seen even in high-income countries like the US and in Europe that healthcare systems have buckled under the pressure that this disease causes. So it's a factor of the disease. We know that none of our health systems were really built to cope with the number of people that we've seen.
So we see cases that are sent from home, and we see cases that are sent from health centers. They are sorted outside, where we classify them into COVID or non-COVID. From there, we can manage them in the tents, or if they're very unwell, we send them inside and we see them in our research in our main ED. From the main ED, we then see whether we need to escalate up to ICU or the regular or the other wards.